All right, so hi, everybody. Good evening, and thank you all for joining another edition of the NYGA webinar series. This one, a very, very awesome topic on the gut-brain connection with two very awesome presenters that I will be talking about momentarily. Just a few housekeeping rules as everybody's piling in and we're getting ready. This webinar is being recorded. It will be put up later, but obviously none of you guys, none of the names or anything is being put up anywhere. Please ask any questions that you would like the presenters to answer in the QA section as opposed to the chat box, because that's the one that I'm going to be monitoring and sharing with the presenters. We're going to kind of try to save most of this stuff for the end. And we are, without further ado, I'm Dr. Pashinsky, who's one of the NYGA docs. And with us today is Dr. Samir Berry, who's one of our latest and greatest additions to NYGA, who's taken a lot of turns to make it to New York. He studied at Northeastern. He did his residency at Cedars-Sinai on the West Coast, and then did his GI fellowship at the University of Michigan with some of the greatest names and some of the most famous functional GI and irritable bowel experts. He very much prides himself on being an evidence-based, whole person, whole patient, comprehensive doctor, and really specializes in the disorders of brain gut. You see, this is a slip up in GI interaction. So, and joining us today is also Dr. Mariah Parnay, which I probably butchered a little bit, but hopefully not terribly, who is a licensed clinical psychologist. And psychologists are pretty much our right-hand people in these conditions. And she has specific training and expertise in medical and health psychology. She's currently the lead behavioral health provider for Oshi Health, which is a virtual integrated care platform that provides whole person care approaches for patients, such as probably many of you here with digestive health conditions. And Dr. Cornay is passionate about integrated care and improving patients' physical health through psychological and behavioral approaches. So without further ado, I think we have a great number of people already with us. And I'm gonna hand it over to the speakers.
Awesome. Thanks, Dr. Pashinsky. Yeah, my name is Samir Berry. I'm a gastroenterologist at New York Gastro Associates. Really excited to have this presentation with all of you today. Hopefully we'll go through the slides fairly quickly and leave as much time as possible for questions. I apologize in advance if I sneeze or cough. I have the flu right now, so I'm isolating, but I've been excited about this talk, so I wanted to make sure that we didn't have to change things around or change the date. The objectives of the presentation today. First, we want to discuss what this term is. It's being thrown around all over the internet, all over social media. Some of it is evidence-based, some of it is backed in science, and some of it means nothing at all. So we want to really focus on what the evidence means, what the evidence shows about the gut-brain connection. We want to talk then about what does the gut-brain connection mean for patients with GI symptoms, GI conditions. How do we use that connection in terms of treating our patients as gastroenterologists, and then also talk about some of the most up and coming research and what we know, both from an understanding of the pathophysiology of these conditions, but also more importantly, especially for patients, on what it means for treatment, and discussing the integrated care approaches to managing these conditions. One of the things that I love most about working at New York Gastroenterology Associates is we're one of the only practices in the city that works directly with our own dietitians, psychologists. We have close connections with physical therapists in the city. And one of the things you'll take away from the research that we talk about in this discussion today is that managing these conditions appropriately really takes a multidisciplinary care approach. You really need a lot of people working together to help these patients, with the gastroenterologist kind of playing the quarterback role. And that's one of the great things about NYGA or New York Gastro, that we have those connections to be able to kind of facilitate that kind of care. So without further ado, let's just go ahead and jump into these slides. And so just to start off, what is this gut-brain connection? What it's referring to is the enteric nervous system, which is also called your second brain, the second gut. Where did this come from? Evolutionarily, this gut is this second brain is what protected us from environmental threats. If any of you have felt butterflies in your stomach, when you're nervous, or if you have children and they're nervous about something, they're getting bullied at school, a lot of them will have abdominal pain. When we're stressed out, we all just need to sit down and have a big meal, have comfort food. If we haven't gotten great sleep, overnight. The first thing we're going to grab in the morning is usually some comfort food. That is all those evolutionary kind of perspectives of what created this second brain or the enteric nervous system. What we're starting to learn is that the link between our brain and our second brain, the brain in our gut, is one of the strongest links in our body. There's actually more nerve cells in the enteric nervous system than anywhere else, than any other part outside the brain. And these nerve cells impact our mood, they impact our psychological well-being, and they actually impact our brain's response to stress as well. And so what a lot of the research is starting to show is that our brain actually impacts our gut, impacts the symptoms that we feel, but then our gut can actually send signals back up to our brain and impact our mood, impact anxiety, impact depression. And that's basically the way that this field within gastroenterology has started to evolve. And so where did this come from? In the late 19th century, this is when we discovered that there was this second brain called the enteric nervous system, part of the autonomic nervous system. There's about 500 million neurons, those nerve cells that I was talking about, that are not sophisticated in the way all of us may think about nerve cells, right? They're not going to help us use a phone. They're not going to help us talk to somebody, but they're there and they're always sensing what's going on in our environment. And they can definitely control the functions of our gut. So that's digestion, swallowing, having a bowel movement, extracting nutrients from our food, all of those things that seamlessly just kind of happen behind the scenes in most patients and most people. That's what these nerve systems do. They can function independently from our brain, from our central nervous system. And what's most exciting is now the latest research actually starts to show that their communication between the gut and the brain actually has an impact on a lot of the conditions and diseases that we treat as gastroenterologists: irritable bowel syndrome, even inflammatory bowel disease, reflux. We're starting to learn a lot about how these nerve cells can impact these symptoms. What makes it really difficult is that the tests and diagnostic tools that we have today don't do a great job at looking at the nervous system communication. So when we do colonoscopies and endoscopies, which we need to do to rule out more serious conditions in many cases, or when we do imaging studies, we really can't see what's going on with the nerve cells. And so we have to come up with newer tools and techniques. And that's why working with our GI psychology colleagues is really, really important, because most of us just don't have the tools to be able to tell what's wrong when it's the nervous system that's creating these problems. Some of the newest findings that we found with how these nerve cells impact GI symptoms is really predominantly focused on the vagus nerve. So this is one of the longest neural pathways in the body. It connects the gut and the brain. It communicates between the gut and the brain. And it uses the same neurotransmitters that are used in our brain when we kind of feel sleepy or tired or sad. Neurotransmitters are basically small chemicals in our brain that get us to feel certain ways. So if our boss sends us a stressful email, it's just neurotransmitters that are firing and making us feel stressed. If our significant other brings us flowers or a gift and we feel happy, again, it's just neurotransmitters that are making us feel happy. Well, those same neurotransmitters that kind of conduct signals in our brain, they conduct signals between the nerves in our gut. But instead of making us feel those certain emotions, they can actually make us feel certain GI symptoms: diarrhea, constipation, bloating, abdominal pain, reflux. And in fact, a lot of the nerves in our gut make these neurotransmitters. So 90% of serotonin, which is the happiness neurotransmitter, is actually made in the gut. And so we're starting to learn a lot more about this part of the gastrointestinal tract, and it's a very exciting part of gastroenterology because it's going to enable us to create new treatment paradigms for our patients. Back to the vagus nerve, in addition to everything I already mentioned, we actually know from studies that patients with irritable bowel syndrome and Crohn's disease actually have a reduced vagal tone, which may indicate that it's just functioning a little abnormally in these conditions. And we're going to learn more and more about other conditions as well. There are other studies that actually suggest that patients with irritable bowel syndrome may misperceive signals from the gut. And it can create, again, those negative emotional reactions that increase our vulnerability to any of these symptoms. And it's a vicious cycle, creating more worsening GI symptoms that Mariah is going to also talk about as well. One of the things that, a lot of us learned in grade school or in college was about the fight or flight response, right? And this is a hormonal response, but it does help us understand how the gut-brain interaction works. What this response was designed for, from an evolutionary perspective, was, if we were getting chased by an animal or hunted, to be able to quickly prepare our body to take on that threat or stressor. So what happens? Our heart rate increases, our breath becomes more shallow, our glucose levels increase. But what happens in the GI tract? There's a lot of changes that are happening in our GI tract when these things happen. We can have more bloating, more flatulence, abdominal pain. Some of us can actually get diarrhea or constipation. And so this can actually help contribute to some of these symptoms. Again, if we don't tone down this response in certain patients that are responding in this way. And this access, this fight or flight access, can actually misfire. And the nerve cells that kind of are responsible for keeping this access in check can misfire in response to certain foods, in response to chronic stress. Inflammation and higher levels of inflammation can create abnormalities in this part of our nervous system. There's also high linkages in the research between childhood trauma and past trauma, and this nervous system being able to kind of appropriately react. And so in some patients, they may not feel the emotional component of this as much, but they're really getting all of the significant impact from a GI symptom perspective. And that's, again, why it's important to take this dual approach to think about the gut-brain interaction when we're treating patients with a variety of GI conditions and symptoms. The opposite of the fight or flight response is really the rest and digest part of this hormonal axis. And this is really the parasympathetic system. And so what happens here is, again, if the vagus nerve gets stimulated, we start to kick off this rest and digest part of our body. Now, this happens normally. Both of these things can happen normally. The problem is when they start to misfire or occur when they shouldn't be occurring, it can create GI symptoms when they shouldn't be happening. So, for example, every night when our body, goes to bed, we prepare for rest, this part of our body gets activated. And that's important because, we don't want to be, getting overly reactive at night. We don't want our heart rate to go up. We want everything to just kind of calm down. But in certain GI conditions, we've actually been able to prove that there's a disruption between these nerve cells. For example, in patients with irritable bowel syndrome, we see a high correlation of IBS and insomnia. We feel that that's really actually related to this nervous system and these connections not forming in the right way. And so again, sometimes it can be really hard to wind down or relax, and you can actually notice worsening GI symptoms when you're having that extra stress, that extra anxiety. That doesn't mean that all these symptoms are in your head. And unfortunately, that's too often what patients hear, whether it's from a physician or a relative or a friend, they'll hear, oh, you had a colonoscopy, you had an endoscopy, you had a CT scan, everything was normal. There's nothing wrong. The symptoms are just in your head. You just need to calm down. That's not at all true. What's actually happening is the nerve cells are not functioning correctly in the gut, and that's what's creating these symptoms. And so that's a brief overview. I'm really excited now to turn it over to my colleague, Mariah, who's a licensed psychologist. And so she's going to walk you through some of the emerging treatment approaches that we have for treating these conditions. Go ahead, Mariah.
Thanks, Samir, for that overview of what's going on in the body. So as Samir mentioned, I really kind of want to focus on that integrated approach, especially because a lot of times, in my experience of working with patients might have been made to feel as if their symptoms are all in their head. You might even have had contact with going to a psychotherapist in the past, but your GI symptoms are present. So let me just talk about this kind of new wave approach that we call psychogastroenterology. So essentially what that big word is this branch of psychology that is appreciating the behavioral strategies that influence the gut-brain connection. that gut-brain connection that Samir just kind of talked about, and that disruption. So these type of interventions are really targeted for that gut-brain interaction. So it's even at the point now where those conditions that used to be called these functional conditions, I mean, like IBS, we call them disorders of gut-brain interaction, DGBI. So this is a newer term, but you might have heard about this or come across this. This is what Samir was talking about, that there's no kind of physical tests that can really show what's going on within the nervous system, but we know that there is some disruption there. We know that there's this bidirectional back and forth communication that's happening, that a lot of times, whether it's chronic or new, there is some disruption there. More evidence for this is the fact that a lot of patients do make dietary changes, which is, one of the first line treatment approaches. But if you make dietary changes alone, a lot of times, rarely, only food is the primary trigger for your symptoms. So we have to think about other approaches to add and complement those dietary changes as well. Again, many of the patients that I've worked with, they come in and say, I've done all of these, diets, I've restricted, I've done all of this, but my symptoms are still present. The reason why that is, we want to look a little bit closer to the gut-brain interaction and see kind of where the disruption is there, behaviorally and psychologically. Even for those conditions like IBD, so like Crohn's disease, ulcerative colitis, those things that are more inflammatory, that we can say there's more of an organic origin. What we do to help intervene with those is really focusing on lowering the body's stress response. Because we know the stress response can contribute to inflammation, reduce immune activity within the body, which, again, contributes to that vicious cycle that we talked about. Finally, like I mentioned earlier, a lot of patients that I've seen, they might have, go to the doctor, can't really find a physical origin. So it is recommended for them to go and seek out a traditional psychotherapist, but they're still having symptoms. And the reason why that is because really a traditional psychotherapist, their focus is on that emotional functioning, not necessarily the interaction that's happening between the gut and the brain. So how is, psychogastroenterology different? What are GI psychologists doing? We're doing these interventions that's called brain gut behavioral treatments, or BGBTs. And really the overall focus here is to target those interactions that are occurring between the brain and the gut. As you can see in this diagram, there is this kind of vicious cycle. Does it start in the brain? Does it start in the gut? More and more research is actually showing that majority of the communication is happening from gut to brain. It used to be thought about the other way, that, you're stressed out, is causing you some IBS, some irritable bowel, some diarrhea. So go and, check out your emotions, go to therapy. You go to therapy, but the symptoms, again, are still there because, we're recognizing that it's not just so simple that it's happening from brain to gut. There's this kind of back and forth interaction that's happening. So really the overall aim here is to do these interventions. A lot of them are behavioral and psychological in nature, to really focus on reducing and alleviating your GI symptoms, improving your overall digestive health, focusing on your quality of life. GI conditions are some of the most stigmatized conditions and have such a huge impact on overall healthcare access. How often you're calling out of work, how often, you're not able to go into work and just kind of function in your day-to-day social life, going out to dinner with friends, just kind of normal routine things that are really being impacted because you are dealing with these GI symptoms. So a lot of the interventions as well is focusing on improving your quality of life, your overall well-being, and how you're self-managing your symptoms. So there is a gamut of what we call brain gut behavioral therapies. One of our most common and foundational techniques that we like to teach is called diaphragmatic breathing, or you might have heard of the term of belly breathing. You might even have experience with, with exercising, yoga, what have you, with doing some deep breathing. But I really want to focus on how diaphragmatic breathing really helps your GI symptoms. Diaphragmatic breathing is a very simple yet powerful technique that helps not only with just relaxation. We're not here telling you that you need to go and relax. You need to, just improve your stress and your GI symptoms will get better. What we're doing here is we're really activating the body's rest and digest response. Remember when Samir was talking about the parasympathetic nervous system via the vagus nerve. So what we're doing with some nice deep belly breaths, we are stimulating that vagus nerve that runs from your digestive tract up to your brain. So again, your stress response is happening automatically in the background all throughout the day. So your body is normal. It's normal for your stress response to go off. It doesn't mean you're feeling overwhelmed. It doesn't mean you're feeling stressed out. But just think about when you wake up and get out of bed, a little bit of adrenaline is flowing just to get your energy up and get you going for your day. You go and you get in your car, you're in traffic, stress response is going off then. Stress response is going off so that you can perform your work. The problem is with a lot of us, we're not really implementing or having that relaxation response till we're getting ready to go to sleep at night. So what diaphragmatic breathing is doing is helping you implement that relaxation response throughout the day, and similarly to how your stress response is going off. So it's literally putting a brake on your stress response that, again, is happening naturally, and it could be continuously. A lot of the research is showing that when you have a condition like IBS or GI symptoms, a lot of times it's very hard for your body stress response to turn off naturally. So it's just kind of constantly and continuously running in the background. Think about all of the times that you have abdominal cramping, abdominal pain, and it just seems like it's never going away despite what you're doing. That's even more evidence of kind of that constant stress response that might be happening. So some of the GI benefits I've listed here, we see, a wide range of benefits from reducing bloating, those feelings of urgency that might come on prior to having a bowel movement, abdominal pain. It does really help improve digestion, helps reduce GERD symptoms, reflux, if you deal with that as well. There's a lot of more newer wave research is showing the really strong benefits of that. And then helping you with more complete bowel movements as well. And just the start of all of the benefits that you get. The key to doing diaphragmatic breathing, when we're doing deep breathing in general, a lot of times the focus is on the chest. We call it diaphragmatic breathing because we want to direct your focus of breathing to your stomach, really slowly filling not only your chest, but your belly with air. And then also kind of really exhaling all of that air out. What's happening when you breathe in this way, you're creating this kind of internal action with your diaphragm. Your diaphragm is getting stronger and your diaphragm is contracting, expanding, and it really does soothe the digestive tract at the same time. So again, this isn't simply for you to just learn how to relax, get ready to go to bed. This really is to compete with that body stress response to help that gut-brain interaction that's possibly disrupted. So another technique that I love doing in my practice and working with GI, and it's actually lots of evidence where there's a particular protocol that's called cognitive behavioral therapy for GI. So we call it CBT GI. So again, if you have any mental health history, you might have heard this term CBT. CBT is a very kind of trendy term when it comes to dealing with mental health symptoms. But over recent years, over the past 15 to 20 years or so, we've started using CBT for things like chronic pain, things that are physical symptoms, even like, ringing in the ear, like tinnitus. So what CBT for GI, again, is not really focusing solely on the emotional impact of your GI symptoms. It really is focused in on the fact that there's this vicious cycle. So if you see kind of the diagram here on the left-hand side, it's just really highlighting that cycle that's going on between your stress and your GI distress. So the stress is contributing to your GI symptoms that's contributing back to your stress, this never-ending cycle. So what we know in general, your thoughts, your feelings, your behaviors, and your physical symptoms are all connected to each other. So this is the reason why we use CBT to help disrupt it. So one of the easiest things that we can make a change with is maybe not your thinking, we might want to look at your behaviors. How can we shift your behaviors? And one of the behaviors that we might want to implement is that belly breathing, that diaphragmatic breathing, doing some things in your routine that we know is going to give you some nice symptomatic relief. CBT for GI is not solely about learning how to cope with or deal with your symptoms. We're not saying that this is something that you absolutely have to deal with, but these really are evidence-based tools that improves the ongoing gut-brain communication that is disrupted and might be worsening your digestive symptoms. So as we kind of recognize the connection between your thoughts, your emotions, your behaviors, and your physical symptoms, we might do things like what we call thought logging. This is very similar to journaling. So, think about a time where you get invited out by a friend to, a restaurant that it's been a long time that you've been to. First thing that comes up is, oh my God, I wonder where the restroom is. I wonder what's on the menu. Is there anything that I can eat? Am I going to have symptoms in the middle of dinner? This is going to be so embarrassing. So the fact that you're having those thoughts alone are sending those kind of alerts to your system to be on alert, to be on guard. So think about the body stress response. So in return, your gut starts preparing for what we call this perceived threat, the fact that it's really stressing you out. And next thing you know, the GI symptoms that you were trying to avoid are happening. It is hard to cut it off. You might even avoid going out, which just makes, a whole gamut of problems as well. So that's really what we're targeting and focusing in on the CBT. So again, it's not just the emotional experience. We're not saying you have a mental health condition, a mental health disorder. What we're noticing is that, all of these things are interrelated with each other. So where can we stop? How can we intervene to stop this vicious cycle? Whether we do address your behavior or your thoughts or your feelings or a combination of all of those. Mindfulness. So I really enjoy talking about mindfulness because I think mindfulness in general is a very kind of trendy, up and coming term in general. Dealing with just recent stress or a lot of stress over the past few years or so. Mindfulness is one of those tools that has been talked about a lot, just, helping people learn how to relax. So how can we use mindfulness to really help with your GI symptoms? What mindfulness is doing is really encouraging you to focus your awareness on the present moment, what we call the here and now. So right now, and, learn how to accept your thoughts, your emotions, and your physical symptoms without judgment. So again, a common GI symptom experience, you might think, will I feel well enough to go to work tomorrow? Or is that stomach pain just something I ate? Or am I about to have a disease flare? So when you're thinking like that, you're not really focusing on the present moment. You're focusing on what just happened, maybe in the past, and you're thinking about what's coming ahead. So mindfulness really is an intentional focus awareness. It does take practice. I will say that many people do feel relaxed after doing a mindfulness exercise, but that's not really the goal. The goal is really to actively train your mind and your body to reduce your vulnerability to stress. Remember the role of stress in your GI symptoms and the brain gut connection. So that's really what we're trying to intervene here with. We're trying to bring your attention there so that you can become more aware of the sensations that's happening in your body. A lot of times when you're dealing with GI symptoms like pain and, just things that you're dealing with on a day to day, you just learn how to deal with it and it's in the background. Mindfulness is actually teaching you to embrace that, bring it into your focus awareness so they'll help regulate kind of what's going on between your emotions and your physical symptoms and your digestive tract. So it does take a lot of practice. This is something that our brains aren't really equipped to think of and think this way naturally. Our brains are very flexible. We are able to multitask. So mindfulness is really telling your body and your brain to slow down, really kind of focus on the thoughts that are arising in a very targeted way, and just allow those things to flow. So what I notice after practice, it becomes easier and easier to focus your thoughts and your attention. I like to do gut directed mindfulness meditation where I'm taking my patients through like a scripted guide where I'm really having them embrace what's going on within their gut. I actually have them envision kind of, what is that feeling like? Is it like, a burning sensation? Is it like tightening? Some of my patients describe it as like a balloon is getting ready to burst. And I try to replace those messages with something that's more calming and soothing. So, whether someone is calmed by, thinking about the beach, or whether someone is calmed by thinking about their infant baby, the smile on their face, we try to replace those messages and help your body regulate in that way. So mindfulness can be done on your own, but I really recommend doing this with a licensed professional because this is something that, it really is intended to be a guided experience. Finally, another kind of behavioral intervention that I want to talk about is this technique that we call is gut focused hypnotherapy. So a lot of people, I'm pretty sure you've heard of hypnosis, but there is lots of evidence more recently. This is an emerging intervention, especially for IBS, so irritable bowel syndrome, that can have long-lasting benefits. So when I think about patients who might benefit best from gut-focused hypnotherapy, this is more of what we call a passive approach. This is something that you're brought into this deep relaxation state. The more kind of you're relaxed, the more your brain can really focus in on whatever the stimuli is, with the goal of improving the signal between your gut and the brain. So what's happening when you have that enhanced focus, it really allows your brain and your gut to receive these signals. So what the clinician is doing is they're using verbal repetition and mental images. They're really kind of describing a verbal scene or some type of like calming scene that you discussed prior to doing this activity. That's going to help facilitate a sense of calm and peace within you. And it's really opening you up to suggestions. So it's not necessarily about mind control. Hypnosis is not about mind control at all. Rather, it's helping you to feel more in control of your symptoms, being in a very deep, relaxed state. We're sending you those messages. So I have a quote here that might be commonly used. Allow the sensation of comfortable warmth in your stomach to create comfort and control. Discomfort is a thing of the past. And that might be something that I repeat. I repeat multiple times, and that might be the whole kind of session of hypnotherapy for about 10 to 15 minutes, because what we're doing is we're trying to tell the gut to send signals to the brain that I am calm, I am at peace, I am safe. Remember, this is an evolutionary perspective. From evolutionary perspective, this is, something that has evolved over time. However, your gut can still perceive threats within your environment whenever there's a threat actually not there. So really, we're trying to remind your body and your gut and your mind that you are safe. Gut focused hypnotherapy can be delivered via what we call a digital therapeutic. So this is an app that can be either prescribed by a GI doctor. Some of the apps don't necessarily need a prescription, but it does make it pretty convenient for those who are on the go or you don't really have a lot of time within your day-to-day schedule. It only takes about a dedication of 15 to 20 minutes or so. Like you might want to pop it on like when you first wake up and during the day, maybe during your lunch break or even at night before you go to sleep. So it's been really cool seeing all the digital therapeutics that's come out that can implement this type of intervention. And I wanted to talk a little bit too about neuromodulators. This is medications that are focusing in on the disorders of gut-brain interaction. So you might have been recommended at some point in your GI symptom journey, how about try antidepressant? You might be thinking, okay, well, if you don't think I'm crazy, it's not only my head, why would you give me an antidepressant? But what we're realizing and what we're noticing, there are some antidepressants, what we call TCAs. So these are tricyclic antidepressants, which historically aren't necessarily the best for depression. However, they have great benefits for improving those neurotransmitters, those chemical messengers that are communicating between your gut and your brain. So TCAs are really, they're really well tolerated. A lot of times you take it at night, it can really help your sleep, especially if you have that kind of IBS-induced insomnia. And it helps a lot with GI symptom pain. There's this idea of visceral hypersensitivity where absolutely you're experiencing pain over time because the way your gut and your brain is communicating with each other, you start paying even more attention to your pain, where your pain becomes super amplified, where even something that used to be such a small tingling of pain to you before is now causing like maybe a full body experience of very, very painful stimuli. So this is where we bring in what we call a neuromodulator, which a lot of times might be in the antidepressant class. But again, it's really there to rewire the communication that's happening between your gut and the brain. A lot of times you do a round of this, so you might be on what we call a neuromodulator for several months, but the lasting benefits that you get, research is showing at least, on average 5 to 7 years, which is pretty long lasting considering you're only kind of dedicating a few months of taking an antidepressant where you start getting this long lasting relief. This is definitely a more new wave approach, but it's something that we see lots of great benefit with. So I just want to summarize everything we talked about here. Look at this diagram. It's a very kind of intricate system, but again, there's so many different connections that we're learning so much new things. Research is evolving on a day-to-day between kind of what's going on between the gut and the brain. Just know that it is one of the strongest connections within the body. So when you hear the term like mind-body medicine, gut-brain connection, this really is something that's happening. It's physiologically, there's something that's happening on the day-to-day, throughout the day, communication back and forth between your gut and your brain. Just know that even if you're not actively feeling stressed out or overwhelmed, the fact that you have a digestive condition alone makes you even more vulnerable to experiencing emotional stress. So again, we can't just say that it's all in your head. I actually argue a lot that it's all in your gut, and the fact that you're having these gut symptoms is making you even more vulnerable to having like maybe depression or anxiety that's related to disruption that's happening with those chemical messengers that's coming from your gut. I highly recommend seeking care with GI specialized practitioners, like what Samir said that you have here at NYGA, because these are the types of practitioners that have the knowledge and expertise to specifically target the gut-brain interaction. And that includes what we call GI psychologists or maybe GI specialized nutritionists, because it does take kind of that integrated whole person approach. So again, research is ongoing and we're learning new things daily. So while there's many interventions that exist, we are still researching and learning more and more about this connection. And that's just an attempt to offer these resources to patients who have been suffering for a while. You know, if you've, been diagnosed with this for maybe even like 15, 20 years, you might even see like over your treatment trajectory how things have changed. Medications aren't necessarily the only option, and we are moving more towards behavioral and psychological approaches, dietary changes, managing your stress, all of these things that are really going to contribute to your better quality of life.
Yeah, that was great. Thank you so much for that overview, Mariah. We're so lucky to have like such detailed psychologists now that are working specifically in this field. One of the challenges of treating these conditions is if you go to a regular psychologist, most of their patients have anxiety, depression, PTSD. Maybe a few of their patients have GI conditions. But working with your gastroenterologist at NYGA, we have affiliations with psychologists that really only do GI psychology, or that's the predominant kind of type of patient that they see, which is really important in achieving the best outcomes for our patients. And then I noticed a lot of people were just mentioning that we were speaking very fast. We want to be respectful of everybody's time. We only have an hour here with tons of data to cover. So you're more than welcome to watch the recording and slow it down or watch it a couple times over. But Dr. Paszynski, how do you want to go through the questions? What else can we do to make the best use of this time?
So thank you guys, you did awesome. And it was a lot of information. And as I've been telling everybody on the chat, this will be recorded. This is being recorded. So it will be posted both on our website, and there's a YouTube channel for New York Gastroenterology Associates where all of our prior webinars are posted, and you could kind of slow down, pause, rewind for anything we missed. There's a lot of questions. I think it's like record number of questions here. So I'm going to try to group them into little categories for you. So there was a lot of questions, Barry, about diaphragmatic breathing. So maybe a little bit more descriptions, maybe more resources of where people could get more information on how to do this, whether it should be done multiple times a day or a particular time of day, and kind of what techniques, just a lot of questions about that.
Yes, definitely. So just thinking about resources, I will point to YouTube and a specific YouTube video. If you look at the University of Michigan Medicine, there's actually a GI psychologist who demonstrates diaphragmatic breathing. I think if you just search University of Michigan diaphragmatic breathing in the search bar, that will come up. But essentially, a very kind of way to do diaphragmatic breathing to make sure that you're doing it right. You put one hand on your chest, one hand on your belly, and you begin by taking a slow inhale in, maybe on a count of 4. It could be in through your nose, in through your mouth. Don't get so caught up on that. But the idea is, as you're looking down and you're doing your inhale, you want to make sure that that bottom hand is also moving, because that way you know that your belly is also filling with air. If only your top hand is moving, try to slow down your breath even more. To really fill up the air, your belly with air. The problem is with a lot of deep breathing techniques, if you're breathing just from your chest, you can actually cause your anxiety. You can actually cause the stress response to happen, because it's like you're running in the environment from danger. So you want to make sure that you're really slowing it down. A lot of times, that's the most common experience that I see, is that you're not going slow enough on the inhale. And then once you do fill everything up with air, go ahead and do even a slower exhale. So try on a count of 4. If count of 4 is not slow enough for you, maybe improve that, increase that to maybe a count of 5 or count of 6.
That's awesome. Thank you. And Dr. Berry just posted into the chat. He just put, there's a YouTube link as well, I think that is related to this and sort of some of the technique. That's awesome. Thank you so much. There was definitely a lot of questions about acid reflux and whether there's a sort of a known or presumed brain gut connection in that aspect. We talk about bloating and cramping and bowel movements. There was a lot of questions on whether reflux has any role in this as well.
I can, Mariah, I mean, I can go ahead and just quickly, briefly start. We actually do a lot of tests in patients nowadays. There's a lot of newer testing that we can do where we can actually place a little acid testing probe at the bottom of one's esophagus. And some patients can click and let us know when they're experiencing symptoms. And in some patients, there's a correlation. So, when that probe senses high levels of acid, the patient has symptoms. But in a lot of patients, there's no correlation at all. And so there's a lot of discussion around, well, are there a lot of these kind of reflux types of sensations that are also driven by misfiring of these nerves? And Mariah can talk a lot about the types of, kind of gut brain therapy that we do specifically for reflux. I think biofeedback is one of the major ones, Mariah, but you're the expert. What are the other kind of therapies that we use for reflux?
Yeah, believe it or not, belly breathing is one of I think there was a study just from last year that talks about how doing some nice, good belly breathing can reduce the amount of reflux events that are happening. Because the thought is that the distance between the lower esophagus and the actual belly where the acid is coming up, it's closer together. So with diaphragmatic breathing, when you're really strengthening the diaphragm, you're increasing that distance and giving your body a little bit more room to go before the acid comes up through the esophagus and you're experiencing those symptoms. So there has been, good evidence with that. I imagine some more recent studies too with gut-directed hypnotherapy as well, just due to the way that the pathway with the diaphragmatic breathing is working. I imagine that we're going to see more research with that come out soon too.
Another big question, sort of a theme that I've seen people asking is, especially our patients with inflammatory bowel disease, patients that have lost a good portion of their gastrointestinal system. So patients who've lost their colon, who've had multiple resection of their small intestine, obviously in addition to, a good amount of, obviously psychological trauma that comes with all of that. There's questions about whether losing this much gut and the loss potentially, are they at a risk for losing serotonin because there's so much serotonin in the gut. So kind of talking about the neurotransmitter side of things and whether there's any data or sort of any, any evidence that we have for that aspect.
I'm not actually aware of any data, Dr. Paszynski, I don't know if you are, about the change in serotonin levels post-surgery. I would imagine your body probably compensates for those kind of lost neurons. But I think what we do know is anytime that you disrupt neural connections, so whether that's a cholecystectomy, which is a surgery to remove your gallbladder, or a portion of your bowel being taken out, right? Even the best surgeons, the ones that we work with in New York City, they're making cuts through neural pathways, right? And those nerves have to reconnect and they take time to heal. And so a lot of us may be familiar with phantom pain or neural pain that just takes a lot longer to heal. Even after the muscles and the skin and the mucosa have healed, the nerves can still be really hypersensitive. And we actually know that from some research that any sort of abdominal surgery can actually make patients more prone to visceral hypersensitivity, which just means, hypersensitive nerves. So we do know that. And from other studies looking at patients with inflammatory bowel disease, we know up to 50% of patients with Crohn's and ulcerative colitis actually have overlapping IBS. So they have both conditions at the same time. They're not mutually exclusive conditions. And if your symptoms are driven by the things that Mariah has just spent the last 30 minutes talking about, the biologics are really not designed to target those symptoms. You need to kind of use two approaches. You have to treat the inflammatory bowel disease or the inflammation, but then you also have to treat all of this visceral hypersensitivity and that the vagus nerve and the neural misfiring. You have to do both to get the symptoms under control. Mariah, anything that from your experience treating tons of patients with Crohn's and ulcerative colitis?
I was going to just add, I think what you're saying is definitely accurate. What the research is looking at is with patients with bariatric surgery. So patients with gastric bypass and how, their serotonin is being impacted. So our bodies love balance. Our bodies love kind of developing this idea of homeostasis. So we do try to rewire those neural connections. So again, just seeing what we see with someone who's gone to go obesity surgery or like bariatric surgery, we do see the ability that the gut-brain communication is there, but there might be that disruption, that visceral hypersensitivity that Samir is mentioning, because there is this post-surgical IBS that happens, or maybe even to even make it complicated a little bit more, post-surgical addiction, where we see like the serotonin, they might need to get treated with antidepressants or so, because there's depression, post-surgical trauma, post-surgical psychological difficulties.
The one other thing I would just briefly add, we do know that the microbiome is essential in producing a lot of these neurotransmitters, right? And so whether they're producing the precursors of the neurotransmitters, or actually helping to produce the neurotransmitters themselves, or actually metabolizing the neurotransmitters in certain instances. And what we do also know is that the microbiome changes not only day to day, depending on the foods we eat, where we are, where we're traveling, but certainly after major life events like having a baby or having a surgery, all of these things can change your microbiome, which in turn can change the levels of neurotransmitters, which in turn can trigger all of these gut-brain interactions. And so that's another really exciting component of the field. And it's something to be kind of in tune and important for gastroenterologists to be aware of.
Yeah, so that was another big theme. There was a lot of questions about the microbiome connection, as well as SIBO, and sort of what role does it play in all of this? Is there any role in the kind of mind-gut therapies in that aspect of GI care? Samir, I don't know if you want to elaborate on that a little further. There's definitely a lot more things that are being asked as well.
Yeah, I mean, all of these, there's nothing we know absolutely for certain. All of this is really cutting edge. And I think what's really important, it can be frustrating for GI patients. The history is so important. So it's very difficult as I'm looking through these questions to just give patients a quick answer, right? You have to really sit down with an expert, a board certified gastroenterologist who's keeping abreast of all the latest research to understand each nuanced case. If the one thing that patients can understand is when you're thinking about the gut-brain connection, the microbiome, childhood trauma, the impact of diet, which we haven't really even talked about at all in this presentation, it's not a one-size-fits-all approach. And that's why having this team-based approach that Dr. Paszynski's really kind of championed at NIGA is so critical. There's nothing really I have to add about the microbiome based on what I've already said. Mariah, in your practice, is there anything kind of tactical, useful that you talk to patients about with regards to the microbiome specifically?
I use that more as just education to help normalize, the microbiome and how the chemical messengers are being carried from the gut to the brain. So very similar to what you've already mentioned. I think it's very healing for a lot of patients to recognize, it's not all in my head. I know that because maybe I had these adverse life events. It doesn't mean, I saw a question here, does this mean that I'm just kind of damaged for the rest of my life? Absolutely not. Just because those alterations are there doesn't mean that we can't, rewire and heal those alterations. Those chemical messengers, again, are being impacted by the microbiome, but that doesn't mean that it's something that's permanent. We can absolutely change it through some of the healing therapies that I talked about.
So you guys are sneaking into my Q&A box, which is awesome, because there's themes I've been trying to group. There's also been a couple of questions about the use of marijuana or cannabis, because I think that's become kind of, the hot topic of, CBD for everything. So sort of any data in kind of some of these disorders. There's questions about, kind of exercise, obviously exercise, diet, and cannabis, kind of the three, factors playing a role.
There's a tremendous amount of research that's being done by our colleagues on the impact of both THC and CBD on a variety of GI conditions. So irritable bowel syndrome, inflammatory bowel disease, reflux, and even undiagnosed symptoms. It's just too early to tell. And one of the challenges about THC and CBD is because of the lack of regulation, it's hard to tell what you're getting, right? I mean, if wherever you're getting THC, whether it's an edible product or a smokable product or a topical product, it's really hard to tell the quality, right? I saw a question about psilocybin, right? So psilocybin is the component in magic mushrooms, right? The hallucinogenic component in magic mushrooms, right? So I think as our community starts to open up more from a political perspective to learning and researching these sorts of components, including MDMA, we're starting to see a lot more openness to studying these types of molecular compounds, especially in PTSD. And so I think that'll trickle down to other condition areas like GI. And that's a whole new world for us to look at for therapeutic targets for our patients. But for now, I think it's just too early to tell. Exercise and sleep are just a core component of GI care. I know Dr. Paszynski, myself, and Mariah counsel every patient about that, because if you're not sleeping well, if you're not eating well, if you're not exercising, your inflammation is going to go way up, and medication is just not going to be as helpful. So that's just a core part. But like Mariah said, there's a lot
do
of
as we say, not as we do sometimes, but yeah.
right, exactly. The thing is, it can be a chicken and the egg problem, right? It's really hard to get good sleep if your GI symptoms aren't under control. And so that's again why working with a team who can help you say, okay, we're going to use medication for this amount of time, get your sleep a little better, get the gut-brain connection in a better place, try to pull you off your medications and go from there.
Let's see. Is there anything else that you see here? Kind of any other questions that you think, you could do a bunch of input on? I think I've moved some along that that we've talked about. Yeah, there's definitely a lot of questions about trauma, sort of early childhood trauma versus later trauma work, and kind of the various modalities. And I feel like depending on what modalities somebody has had over the years, there could be just something that was not explored, whether it's hypnotherapy or actually finding the right therapist to work with, because sometimes that connection is really important. That trust level is really important. This question about probiotics, I think this kind of goes back to the microbiome side, where we're just not sure. And actually the latest article this week was actually talking about the opposite effect of probiotics, and they're being marketed for and sort of not being helpful because they're diminishing microbial diversity. So I think these are, kind of less is more in a lot of these cases.
Or to the trauma aspect too. So a lot of times in my work with patients, because it is so specialized, we really are focused on what we call the brain gut behavioral interventions. A lot of times that will bring GI symptom relief, but what I'm recognizing is that there's some room for more trauma focused therapy. So at that point, since I'm not a trauma specialist, I'll just, make sure that the person is connected to a trauma specialist. I saw someone mention in the chat, the body keeps the score, the body tells the score. It's a wonderful book, a wonderful kind of self-resource to know that a lot of times our expression of trauma might not be emotionally. It might be something that's being expressed within the body physiologically. So again, it doesn't mean that you're just going to have these myriad of physical health complaints for the rest of your life. You are more vulnerable to that. However, there is, these curative approaches with the brain gut behavioral therapies, plus maybe some traditional psychotherapy if the trauma is unresolved. But a lot of times when I am focusing on the GI symptoms, the body has a way, again, of balancing itself, rebalancing itself, rewiring itself. Sometimes trauma is connected to early childhood experiences of hospitalizations. Sometimes it's connected to early childhood experiences of, I was trying to eat and I just got beat. I just got spanked, I just got whooped, or some type of abuse happened around like eating or sleeping or what have you. So when your body starts healing the GI symptoms, it starts sending those alerts to your brain that you're safe. And that in itself helps lower the overall stress response, and that can be curative. So if the one step that you haven't taken is, really working with a GI focused psychologist or GI focused behaviorist, that might be the next best step and the kind of the last piece of the puzzle there to really help you through your physical health complaints.
So there's also questions about neurological disorders and the role of kind of all of this when somebody has an underlying neurological disorder, whether it's MS or Parkinson's or neuropathy and motility disorders or POTS, kind of how does it behave maybe differently? And are there any different modalities used in those patients when there's no neurological component?
Yeah, I mean, I wish I had one of our neurology colleagues on this webinar, but there's a very fascinating and disturbing connection between a lot of GI diagnoses, for example, inflammatory bowel disease and MS or Parkinson's, right? And even the therapies for GI conditions and how they impact certain neurological conditions downstream. There's a lot of research about Alzheimer's and certain proteins that are developed and produced in our gut. And then some of our audience have even mentioned things like POTS and SIBO. And so again, it just goes to show that there are a strong connection between GI diagnoses and neurological diagnoses. I think we're just on the cutting edge of really having a framing to be able to say with confidence what the connections would be. But this is just another demonstration of how powerful this connection is and why, to Mariah's point, it's not all in your head. It's something to be really kind of treated very seriously. There's a lot of research showing that these behavioral therapies actually work far better than medication in patients with irritable bowel syndrome and other similar conditions. So again, a lot of hope if patients have access to the type of team-based care that they should be able to get with their local gastroenterologist.
I think we have answered more questions on this one than I think we have done on any webinars, because you guys are very popular. And I think a lot of the community here has shared a lot of great techniques, books, apps, and other things. So that's wonderful. And we want to really, really thank our presenters who did an incredible job summarizing a tremendous amount of data. And thank you guys all for coming and sharing your evening with us. We're all around. So, obviously seeing a doctor at NYGA will kind of help you get to the bottom of your particular issues because everybody's very unique. And this is very much not garden variety type stuff for a lot of patients. And we really have to take that individualized approach. So thank you all for joining us. I think we're right at the end of the hour. So we're gonna say goodnight and we're gonna let Dr. Berry rest and go back to bed.
Awesome.
Thank you all.
Thanks for having us.
Yes.
And thanks for all the questions, everyone. Appreciate it. Take care. Have a great evening. Bye.
Bye.